Good evening. Good evening. How are you?
Good evening, I'm well. How are you?
I'm fine, thank you. How are things in Birmingham very quickly on COVID? We're going to speak about your speciality today, but how are things in Birmingham?
Of course, well, Birmingham was hit very hard by COVID, but what we're now finding is the numbers of people coming into hospital is reducing. We now have some empty beds, including in intensive care. So we are starting to move about as a UK population a little more, but we're still keeping social distancing, and we
Yes,
hope that the second wave will be small.
I hope so too. Do you know what the rate of infection is in Birmingham, the R factor?
So we believe our R factor in Birmingham is somewhere between 1 and 1.1, so slightly smaller than in Malta, but of course we have a very dense population in Birmingham.
Absolutely.
Yeah.
Thank you very much, Dr. Daniels. I'd like perhaps for you to briefly speak about exactly what sepsis is.
So sepsis is the way the body responds to an infection. So it's always triggered or started by an infection. It might be pneumonia, it might be a water infection, it might just be a cut on the hand. But in sepsis, the body's immune system overreacts, and that starts to damage the organs. In terms of how many people this affects, this is 50 million people worldwide every year with 11 million deaths. So it's a huge number of people who suffer this condition every year.
Absolutely, very huge. And how did your interest start to raise awareness with sepsis?
So it started when it was back in 2004, and I watched a young man die. He was only 37 years old, and he died on my intensive care unit. He did not need to die, and his death struck me because he had small children, similar age to my children at the time. He left a wife. They did not deserve to lose their daddy. They did not deserve to lose their husband. So I thought we can do something about this. So we started a movement.
And is it common in children? I seem to hear about quite a lot of children getting sepsis.
So sepsis is particularly common in older adults and in very young children. So children under 1 year old, particularly so, children between 1 and 5 can get sepsis as well. It's important to know that children are less likely to die. They're more likely to survive if they get sepsis, but parents also need to know about sepsis.
And I think there is a lack of education. How would a parent recognize that their child has sepsis?
So we know our children. We have to trust our instinct, whether it's the mother or the father. We must trust the instinct. And if we are very worried about the child, we need to ask a healthcare professional, could this be sepsis? There are some things to particularly look for. Now, some of them we know, the rash that we worry about with meningitis that does not fade when we press a glass against it.
Is it a similar rash?
It can be, but more commonly it's around skin that's mottled or discoloured or very, very pale, or cold to the touch in children. So if our child's very cold to the touch, their skin's very pale, or it just looks a strange colour or has a strange pattern, that's just as worrying as the meningococcal rash. More importantly is a child who's behaving strangely. So most children will, even if they're feeling a little bit unwell, they will show interest in smiling if they're a baby. If they're an older child, they'll show interest in a smartphone or a tablet computer device. They can be interested in something. A child who has sepsis will be very lethargic, very sleepy. They often won't show interest in anything. If that's your child and you think they have an infection, you need to be worried. And the final thing is if they're breathing very, very fast. If you've never seen them breathe this fast before, again, contact healthcare and just ask, could it be sepsis? Don't wait.
Mm-hmm. Do they usually run a fever at the same time?
So fever, whether it's COVID or sepsis, it's not actually that useful a measure. It can tell us if someone has an infection, but it doesn't tell us how sick they are. What worries me as a health professional more is a child who has a very low temperature. So forgive me, I don't know whether you use Celsius or Fahrenheit in Malta, but if a child's temperature is below Celsius, good. If a child's temperature is below 35 degrees Celsius, that's more concerning than a child who has a temperature of 39 degrees Celsius. So use temperature to tell you that your child has an infection, but not to guide you as to how sick they are.
Absolutely. So you must watch how they're behaving. How does it affect patients with COVID infection?
So patients with COVID-19, the first thing to say is that their illnesses are similar. Even if COVID-19 is the only infection they have, the way the immune system overreacts and the clotting system overreacts, that can happen in sepsis too. So patients with COVID-19 can develop multi-organ failure like patients with sepsis. But a number, somewhere between 1 in 10 and 1 in 3 patients with COVID-19 are also developing sepsis. So it's directly related.
And what comes first? COVID-19 comes first and then it's followed by sepsis, or the other way around?
Well, it can be both, but more typically, COVID comes first and then sepsis develops as a consequence of COVID, or because they've got another infection on top of COVID with a bacteria. But some patients, of course, particularly in countries where COVID is very prevalent, like it has been in the UK, some patients can, of course, develop COVID in hospital when they've been admitted for another problem.
Absolutely, because they pick it up from somebody else.
Yeah.
As chairman of the Sepsis Alliance and your work, your continuous work, can we highlight and share some awareness on your Sepsis Awareness Day?
Absolutely. So World Sepsis Day occurs every year. This will be our 7th year this year on September the 13th. So that's a date to remember. Now, this year this falls at the weekend, but we would encourage hospitals, businesses, communities to come together and have sepsis awareness activities on or around September the 13th this year. Tell your friends, tell your family, tell your clients, tell your workers. And if you're a hospital, let's put on a big show and tell our public about it, because the message is really important.
Do you organise any events whereby you link up with other hospitals around the world just to educate them and brief them about it?
Well, absolutely. And we would be very happy from the UK Sepsis Trust perspective to have some webinar, some event online with Maltese hospitals to try to get the messaging across in a responsible way. There'll be some great clinicians in Malta who know sepsis very, very well. But if we can work to help to accentuate that message and reach more people, fantastic.
I'm really glad we've managed to raise some awareness today. Just before we leave you today, a quick update on how life is for you today as a frontliner.
So it's been really hard. I mean, we've been very, very busy. We've had 3 times the number of patients in intensive care than we normally have. And it's been emotionally difficult. Normally, we're very close to a patient's family. We can touch the patient. We can't do that because of PPE and because families are not allowed to visit. So it's hard, particularly when someone is very, very sick, to talk to the family only by the phone. So we can't hold the hand, we can't sit with them, we're just on the phone. It's difficult. We've seen more people die than we're used to, and it's very hard. I think for people who've been around for a while like me, it's difficult. For young health professionals, young nurses, it's incredibly difficult. This is not how they envisaged their first years in the health professions.
Absolutely. Can I ask you about testing with healthcare workers? Is it mandatory where you are?
No, it's not. And this varies from hospital to hospital. There's no national guidance within the NHS as to how we test health professionals. But what we're doing at the moment, certainly where I work, is any health professional who has symptoms has to self-isolate and for at least 14 days, and they will get a test if they have symptoms. So I had COVID-19 4 weeks ago. I was tested quite quickly, and then once my symptoms settled, I returned to work.
Right. And just finally, very finally, what everyone's waiting for, the vaccines and the trials, just to round off. Can you share something with us?
Yeah, so we've heard from a number of pharmaceutical companies that there is activity around vaccine work. And initially we were told that it would be between 12 and 18 months. And I don't want to name the companies, but the University of Oxford, very senior figures there, very respected figures there, are now estimating that trials of vaccines can be accelerated, and we might even have a vaccine available before the end of this year. And that can only be fantastic news.
That's really good news. I thank you very much, Dr. Daniels. I wish you a wonderful weekend, and I hope we can see you soon here again. Thank you very much. Thank you. I was with Dr. Ron Daniels, who chairs the Sepsis Alliance globally and also in the UK. And I hope you've had quite a lot of information about this infection that everyone's quite curious about. I thank you very much for joining me. I will be with you tomorrow evening with the news at a later time of 7 o'clock. Good evening. I'm Leah Hogg for Net News.